you all. So in this video I will discuss about CPR, cardiopulmonary resuscitation. So cardio means your heart and pulmonary means lungs, and resuscitation means restart or restore. To restore or restart the function of heart and lungs is called cardiopulmonary resuscitation, CPR. So CPR is also called your BLS and ACLS, basic life support and advanced cardiovascular life support. So it is the method or it is the procedure we use if you haven't any medical devices or any instrument at this time. If you want to survive the patient, then you can use the method CPR. Then what are the eligibility criteria for CPR or indication of CPR in case of your respiratory failure patient and cardiac arrest patient and unresponsive patient. You should start the CPR. Then when to stop CPR? If the patient's heart rate, pulse, breathing is written, then you have to stop CPR. If the healthcare provider said that the patient cannot be survived, then you should stop CPR, because if the brain until 5 minutes, if brain cannot get oxygenated blood or brain cannot get blood, then irreversible damage of brain cell occur. If the brain cannot get until 10 minutes blood, then permanent brain damage occur. And if the emergency devices are arrived like defibrillator, you have to stop the CPR. Okay, then the age group for CPR: adult 8 years or above 8 years comes under adult. Then children 1 to 8 years comes under children. Then infant up to 1 year comes under infant. Then 0 to 28 days comes under neonate. Then how we can give CPR? So at first check responsiveness. Ask the patient, hello, are you okay? Ask the patient. Check the responsiveness. Then check pulse and breathing. Look, listen and feel the breathing. Okay, then pulse. In case of adults, the site of pulse is your carotid. In case of children, the site of pulse is carotid and femoral. And in case of your infant, the site of pulse is brachial. Then guidelines. Here is the guidelines. C for compression. You should maintain the compression 100 to 120 compression per minute. Then airway. Then patent the airway. Here two methods are available. First one is head tilt chain lift method. Then second one is jaw thrust maneuver method. This method is contraindicated in case of trauma patient. Then start breathing. Here is some advanced airway such as here tracheostomy care, intubation, then laryngeal face mask. And then here is the compression and ventilation ratio. In adult, single rescue 30:2. In children, single rescue 30:2. In infant, single rescue 30:2. In adult, double rescue 30:2. In children, double rescue 15:2. And in infant, double rescue 15:2. Okay, so in case of neonate, the ratio is 3:1. So 30:2 is one cycle, and 5 cycle completed in 2 minutes. Okay, so speed of ventilation. The next one is the speed of ventilation. In case of adult, 10 to 20, 10 to 12 breaths per minute. So each breath contain 5 to 6 seconds. Then in children and infant, the speed of ventilation is 12 to 20 breaths per minute. So each breath contains 3 to 5 seconds. So the completion landmark is adult and child. Actually the completion of landmark is a lower half of sternum, but in case of adult and child, the completion landmark is between the nipple, and in infant lower or below nipple. So here is the compression depth. In case of adult, the compression depth 1 and 1/2 to 2 inch, and in case of child, the compression depth is 1 to 1 and 1/2, and in case of infant, the compression depth is 1/2 to 1 inch. Okay, so 1 is content 5 centimeter. So thank you.